Antibiotic resistance is becoming a public health crisis of national importance. Every year, at least 2 million Americans become infected with bacterial infections that are resistant to the popular antibiotics that once saved so many lives in the 20th century. We're here with Dr. Tang on more on this issue.
Yes, this is becoming quite the problem. Up to 23,000 Americans can die each year as a result of these resistant bacteria. Many research studies have shown that these deadly microbes are often caused by patient non-adherence or non-compliance to antibiotic medication.
And what does this mean exactly?
Well, non-adherence, also called as non-compliance, basically means patients are not taking medication exactly as prescribed by their doctors in terms of dosage, frequency, and timing. This is very common among most Americans. We all lead very busy lives, and it can be easy to forget to take medication for one day or a couple of days. Or we just end up taking it at a wrong time in the wrong amount. Or we just stop taking it altogether when we start feeling better.
In 2013, the CDC reported that for all prescription medication, only 50% of the medication was taken as prescribed by the physician. Although we're specifically talking about antibiotics today, it is important to note that this information can be relevant for all types of prescription medication.
Yes, that is very true.
We're also here with social psychologist Ida Baliki, who has had extensive research in human compliance behavior. She has some tips for what patients can do to improve their compliance when prescribed an antibiotic.
One thing patients can do to make sure they take their drugs as prescribed is to ask their provider about the exact dosage, timing, and frequency, and think about whether or not this treatment will be realistic with their lifestyle. Patients can also self-monitor themselves using timers or alarms to remind them to take their medications. Be sure to keep in contact with your doctors or pharmacists about questions that come up or side effects that you are experiencing. If you are having any trouble, opt for drug counseling or follow up with your doctor to talk about your drug adherence. And finally, and most importantly, always take all your medications until the treatment ends. Do not keep those for later, and do not share them with anyone else.
Wow, it sounds like there's a lot of resources in place to help patients adhere to their medications. Dr. Tang, what can providers do to help their patients improve their compliance?
Well, doctors can start by providing both written and verbal information about the drug. Question the patient about what you have taught them. Ask them some things they plan on doing to help their personal compliance. Research has shown that lower dosage frequencies make it easier for patients to remember to take their treatments. Provide trust for the patient and be open to the follow-up if any issue arises. And finally, don't assume the patient understands all of the information you are giving them. Try to keep instructions simple and easy to follow.
Extensive research has been done about the effectiveness of these interventions because their consequences can be deadly. If not taken as directed, antibiotics can actually cause infections to become stronger and harder to treat, leading to deadly infections like MRSA and VRE. This can lead to increased healthcare costs, more time spent in the hospital and doctor's office, and greater prevalence of these superbugs.
Patients, make sure you are taking all of your medications as prescribed in terms of dosage, timing, and frequency.
And doctors, make sure your patients understands all the instructions before they leave your office visit.